on the night of the 15th day after the vaccine, and he only took the first vaccine. After dinner, he started experiencing gastro issues. Then he started having chest pain and jaw numbness, and he called the ambulance himself. They were taking his vitals, and all of a sudden, he collapsed like that. It was an acute aortic dissection. People wrote to me from all over the world, all those that had the enormous luck to spend moments with Victor knew how special and unique he was. To be able to admire closely his light, his familiarity, and his strength and his joy, his admirable character, and his capacity to reach to the depths of one's heart. No darkness, no matter how deep, can extinguish the light of that flame. And I got connected with React 19, and that was really, really helpful to find a community, because you guys do provide a community.
Welcome to the React 19 podcast, where we bring awareness and support to the COVID-19 vaccine injured and discuss the science, research, and laws that affect all of us. Hi, everyone. Thanks for joining us again today. I'm Ann Forty with the React 19 podcast, and today my guest is Henrietta, whose 34-year-old son, Victor, died 16 days after his first Pfizer vaccine. After his death, Henrietta began reaching out to specialists all around the world, looking for someone who could analyze Victor's blood and tissue samples to determine if the vaccine had contributed to Victor's death. And indeed, an expert in Germany revealed that Victor had myocarditis and pericarditis. Spike protein was detected in his aortic tissue. And she's here today to share with us the light of Victor's life, the devastation it has caused to her family, and to bring a warning to others. So, Henrietta, thank you so much for being here today.
Thank you, Ann. Thank you very much for having me.
You know what? I would like to start by reading, you wrote a beautiful testimony to your son on the React 19 website, and I would like to start just by reading a portion of that so that the audience can just have an inkling of your wonderful son. Victor was a wonderful son, grandson, brother, and loyal friend. He was competent, well-read, ethical, humble, generous, and caring, often putting others ahead of himself. As one of his dear friends wrote, Victor was always gracious and kind, doing all the right things, not because they were the right thing, but because he was a genuinely caring person and wanted to do them. Victor's greatest love was for his family. He adored his brother and sister and helped set them on career paths by selflessly mentoring them. He was their go-to person whenever they had problems or needed advice. Victor's greatest joy was in helping others. Never did he boast or expect anything in return. In the days after his passing, many, including some we did not know, reached out to tell us how his life had impacted theirs. And I just want to say what an incredible job you did raising this young man, because I mean, your testimony goes on for so much more that he's done and accomplished. And he was a very accomplished young man, and
He was
one who deeply cared. So I just want to offer, sincere condolences. I know this has been so rough for you. As you stated, losing a child such as Victor, so caring, hardworking, capable, and loving, is and will always be the defining moment of my life. I will never be the same, and my family will never be the same. And it is because of that love that you have for this dear son that you have made it a mission to find answers so that other families will not have to go through what you have gone through. So if you'd like to start, I mean, the mic is yours. Why don't we start with just saying, why did Victor, well, let me guess, Victor wanted to get the vaccine to protect others, right? So
Well, yeah, I think, and thank you for, saying those things about Victor. And I have a few other things I came across just as I was sort of
please
thinking
share
about
them. Please share them.
Well, it's just like when I was looking around, about thinking about Victor, because I think about him all the time. But one of the things that came through I mean, people wrote to me from all over the world because he was a world traveler. So he had friends in England and Spain. He had people he knew through his girlfriend in Brazil. He had people throughout the United States. He was very, as you said, he was very accomplished. And people wrote in either letters or on his obituary. And I'm just going to share one or two
Oh,
because
please do.
this is from, in Spanish, he wrote, but I'm going to translate because I'm fluent. And so was Victor. Victor was fluent in Spanish.
Wow.
Anyway, so all those that had the enormous luck to spend moments with Victor knew how special and unique he was. To be able to admire closely his light, his bon ami, his familiarity, and his strength and his joy. It is with pride to have been able to have had the opportunity to fraternize with such a marvelous person. His admirable character and his capacity to reach to the depths of one's heart, our hearts, um, will always be present in our memories. Thank you, cousin, for all that you have done and shown us. We will miss you greatly, but I am sure you are going to help us in our battles in life as life puts those battles before us.
Wow. That is beautiful. That
And
is a
then
beautiful tribute.
And that was just like one, and I got so many. And then like even from work, he had Victor, just to, you know, reiterate a little bit of he had been gone to Boston College. He worked temporarily, for a few years at JP Morgan. Then he went on to Kellogg School of Management, Northwestern School of Management. And when he left there, instead of going into consulting and all these things that normally these kids do, he launched two medical startups with another friend. One of them was to help women with breast cancer, an ablation device. It's still in existence. The company's still in existence, but he was like trying to get the investors and the thing going. And
Right, right.
and then the other one was for an orthopedic device. Again, that's still going. And then he went on and, after about 5 years, he said he needed a change, and he wound up getting a very, very high level senior position at Amazon. He was only there 9 months, but yet I got beautiful letters from those people. And like one of them said, in the light that emanated from your life is present in our hearts. And even in the pain of your absence, your family and loved ones know that no darkness, no matter how deep, can extinguish the light of that flame. And I got so many of those kind of things that, I didn't realize how impactful Victor was, because he was everybody's go-to person, everybody's mentor. He helped everybody he could, get jobs. He looked at their resumes, and and so it was amazing. And then like 2 or 3 years, a year ago, I got something put on his obituary from a friend I never even heard of. I never even knew existed. He had met him in Boston College. And this guy, and he's a doctor now, and he wrote to me that he had named his son after Victor. And it was, I mean,
Oh my
his
God.
second name. His first name, was
Right,
whatever.
right, right.
His middle name.
Oh,
And I said, "Oh my God, I never even knew this person existed in Victor's life." He didn't write, he didn't acknowledge, he didn't, and he said, and then he wrote how Victor was just one of the nicest people he ever met. And he hopes that his son has some of the characteristics that Victor had.
you
So all
know,
of these things makes me feel better, but it doesn't take away the pain, but
I know, and I just, what you said about his light, just reading about the way that you wrote about him, I mean, I sensed that immediately. I'm like, this young man was a man that brought light and life. I mean, it was just so evident in everything that you wrote, what you stated here. And to know that that light lives on in others. And I think, you would definitely like people to know that the best thing that they could probably do for you is to talk about your son,
right, and remember him. And
because
also
you don't
yeah,
want him forgotten.
I don't. And one thing that he did that we are continuing so that he isn't forgotten is in his first year at Boston College, he set up a scholarship for his
Oh,
alma mater in high school. So he didn't have much money. I mean, he was a student, so it was like 100 or
wow.
$150. But for 16 years, he read like 60 essays and chose the best essay and gave that out. That little pittance. I said, wow, 60 people write for, that much money.
Oh my gosh.
But then three of his very good friends, and he had very good friends, I have to say, continued the scholarship the first year, and they gave out $1,000. And then the next year they did a GoFundMe, and within 2 months we had $12,000. So now we're able to continue his scholarship in his
Oh, that's
name.
beautiful.
He
That is
started.
beautiful. We need to I'll put the link to that in the show notes. Send me the link where I can,
Oh, that's
go
sweet.
to
Yes.
that.
No, it's just so, and so this year last year and this year we raised so much money. We gave out two $1,000 scholarships to, worthy students.
Right.
So, we get to talk about Victor. His legacy goes on. It's something he started. And, I remember my daughter
That
was,
go ahead.
I mean, she was in Florida. He said, "Oh, mom's sending the, all the essays. I'll be there, pick them up, blah, blah, blah." Anyway, he just always made sure he followed through on that. And that's just like I said, the
Gosh,
kind
I
of
hope that can just continue and continue and to continue, because
right.
I do think that that is, obviously as a grieving parent, to make sure that his memory lives on, and people remember just the beautiful person that he was and the light that he reflected. And
Thank you.
so yes, take us back to, he did he need the vaccine for work
Well,
or?
okay, so he was working at Amazon, as I said, as a senior manager, and at the time everybody was working remotely. And so he was initially started his job in another state because it was remote, but then he went to Seattle to kind of with his girlfriend to scope out where they would want to live once it was no longer remote. So they went to Seattle and they, tried out one apartment complex, another apartment complex. At that point, it wasn't mandated because people weren't back at the office,
Okay.
but he knew it would be. The other thing about Victor was he traveled a lot.
Right.
He traveled a lot to visit us. He traveled, his girlfriend actually was from another country and went to over Christmas to visit her family. He couldn't go because, of course, he had this new job, so to speak. In order to come back into our country, she had to quarantine in another country. She wanted him to go. He didn't want to go because he was afraid of the whole COVID vaccine and all of that. So there was that pressure to, eventually meet her family and all that. And then, the grandparent thing, that was a really big
Mm.
propaganda. That, when he was here with us, and as I said, he came often, we were worried about grandma and grandpa because they were, at that point, they were like 89 and 90, so they were elderly. And so the propaganda about, killing grandma and grandpa worked on my kids and worked on all of us. And it was probably a very big motivating factor, not the only one. But and also we're from New York. Governor
Oh,
Cuomo every day was, everybody, was on the news. Oh, today 1,000 people died. Today another 1,000 people died. So there was this fear where we lived, especially. I once commented somewhere else that, I wished I lived in a remote area where I wouldn't have felt that pressure.
right.
And Victor felt the pressure, and also Victor was the last to take it. So everybody else seemed to be okay. And although now my sister-in-law is vaccine injured, but not, you know, but so we all seem to be okay. So whatever fears he had, and he did have some questions, and my husband had some questions because we were all reading about, no, we weren't there wasn't that much information, but whatever information there was, it was being squashed.
Oh,
They had articles about, the ferrets dying in certain tests, and things like that. And my husband was very reticent, but again, the grandma thing, the pressure
right.
for outside
New York.
pressure,
Yeah.
and being in New York. So it was a lot of different things that eventually caused him to take it. And He took it on April 20th, 2021. About 6 days later, he told me that he had been experiencing a headache for a few days. And I said, "Oh, do you think it's from the vaccine?" He says, "No, I don't think so." Whatever. Then he never mentioned anything else again. And then on the night of the 15th day after the vaccine, and he only took the first vaccine, after dinner, he started experiencing gastro issues. They had gone out to dinner. And I later learned that's very typical of a aortic dissection to start having
That's good to
gastro issues.
know.
Yeah, and then he started having chest pain. I don't know the exact timing, and jaw numbness. And he called this I know, he called the ambulance himself. I mean, his girlfriend was sleeping. He called the ambulance, got dressed. Then he woke her up and says, "I'm not right. I'm going to get checked out. Don't worry." So
That
he went
sounds
downstairs,
just like what
just
you'd
like it.
expect of him.
Yeah, and he actually went back for his vaccine for his mask because he went down. I don't know if he got to the elevator, realized he didn't have his mask. He went back for his mask, and then he went downstairs. So he went and they were taking his vitals. She arrived because she came flying down, got dressed quickly. He introduced her, and they said he was oriented and alert. And all of a sudden, he collapsed, and they worked
That
on
quickly. Just
like that. It was an acute aortic dissection that quickly because I was talking to him the day before. I mean, he used to call me 3 or 4 times a day anyway. And I spoke to him twice the day before. He was fine. He was laughing. We were talking about something. They went out to dinner. They were celebrating. I even have a dance that she recorded, of them in their living room dancing before they went out to dinner. And so he was fine. He wasn't feeling any of the effects. And I've learned since then that sometimes you can have an aortic dissection without feeling anything. And and that's what happened. And they rushed him to the hospital, and he got there around 2:26 a.m. That I have from the hospital records, and then he was pronounced deceased at 3:15 a.m. The ER doctor came out and asked the girlfriend, did he have the vaccine?
that was that's what he
He did.
asked.
Yeah. And
Wow.
and that was our first clue because he thought he had a pulmonary embolism because don't forget they were talking about blood
Yes.
clots
Yes.
initially.
Yes.
So he thought he had a pulmonary embolism, and she said yes. And so that was our first clue. The coroner, when he saw it was an aortic dissection, he says, "Well, I don't know. He wasn't dilated, didn't have an aneurysm. His heart muscles were good, no high blood pressure. Maybe this is genetic." So he sent out the his blood for testing for genetic collagen deficiency disorders because there are certain disorders that will cause aortic dissections in young men.
Okay.
Usually it's older men that have, older men, 60 or 70, but occasionally you will get a young man, but like I would say 95% of the time, 100%, it's usually because somebody has something genetic.
Right.
Came back negative. I said, well, that's it. It's the vaccine. I knew it was the vaccine. And I said, but we're going to have to do everything possible to eliminate all the other
Right.
possibilities. So we had his blood tested again on the East Coast, not on the West, so it was the West Coast, East Coast. We had all of us tested and nothing. And then I said, okay, so it's not genetic. At that point, other than the fact I was on the couch every day, like just I couldn't get up. I had PTSD so badly I couldn't even leave the house. But I was starting to do research on inflammation because you can't have an aortic dissection without inflammation. And I said, okay, so he had an inflammatory response to the vaccine.
Absolutely.
And so I have like this much research, on that to get it and I eliminated a lot of different things. We went with his medical records and um and what information we had to top doctors. When they looked at his records, they said, no, he could have come into the office the day before and we would have given him a clean bill of health because he did have a bicuspid valve. And so people will pick on that. No, the bicuspid valve had nothing to do with it. And that I have from numerous.
Yeah,
Uh,
you really dotted every I and crossed every
oh, I
T
dotted
because you
every,
wanted to make sure, like, okay, give me give me your best argument why this wasn't the
Right.
vaccine. And you
And I
basically have you've given evidence for every reason why it was the vaccine and not these other issues.
Right. And so, and then I said, okay, then we had his blood serum analyzed. Um, I don't want to go into all the particulars, but we had his blood serum analyzed. I have a 42-page report, and that showed inflammatory markers through the roof. It had IL-6, IL-1, it had all these things. And then when I showed that report to the doctor that did the that wrote the case study, um, he examines vaccine injured people. He picked them out right away. Oh, he's vaccine injured because he knew right away what to
All of
look for.
them. It all lines up. Yeah, you talk about that study, and I printed that off, and I'll put a link to it in the show notes because you have this. This was just recently published, correct? The study.
Well, the case study, the preprint was published in January. The
Okay.
case study was just published about 2 weeks ago. And then just to finish this off, after we had that, we had to search for high and low because no pathologist here in the country would do tissue analysis, histology, because without histology, you don't know technically what has happened. So
Can you
um,
explain to those who are
it's
listening who don't know
it,
what histology is?
examining the tissue under a microscope to be able to really see what happened.
Okay.
Because what they did with Victor was they did an autopsy, but they didn't do a histological study. So they said, oh, aortic dissection, but they didn't look at his heart tissue. They didn't look at his aortic tissue. They didn't look at all of these things to be able to determine molecularly what happened. And so that's where I had to go abroad, get his tissues examined. I was very fortunate. It was, it was a long process. And I got it. And that's when it came back. I was looking just for spike, but it came back with myocarditis and pericarditis and spike protein in the aorta.
Oh my goodness. You knew
And
it.
that's what decimated the aorta. And also, the inflammation was caused also, the toxicity of the lipids were well known. So they already knew from the clinical trial reports, they knew from the first month of the rollout, they knew from 15 years and 20 years of studying, the lipids, that this was not going to be a good thing for people. And whether you reacted or not, it was Russian roulette by and
Right.
large.
Right.
You know, Victor had a vial lot that had 40 deaths. This is just in VAERS, and VAERS doesn't even you know, it's only one or two.
They capture like
No, they
hardly
don't capture
anything.
it. No, it was
And almost every vaccine injured person that I have interviewed, without fail, their doctor, nobody recorded it. Nobody recorded their injury. And Victor's wasn't recorded either, was it? So,
no, I had to record it. And I didn't even really do it right, but I recorded it, just and then one of the one of the things that really got me was I recorded it. I said, okay, this is a death. They should be interested. This is a young man. I'm going to get a phone call soon from the CDC or the FDA or whatever. Nobody called me. So I called them, hysterical. They finally sent me a form condolence letter. Then I called them back again because I said, this is ridiculous. I mean, how and by that time, I was already talking to a lot of people in the neighborhood. Like I would go to the florist, I would tell people what happened to him. I said, oh yeah, my husband took the vaccine and all of a sudden he has arrhythmia and all of a sudden he has this. And my
uh,
sister-in-law had a stroke. And so people are talking within themselves, but nobody's organizing.
right, right.
And so people are isolated from each other and they don't even know where to look, even now, where to look for the information. Fortunately, I did that a Children's Health Defense article, and they connected me with Breanne Dressen, and that was how I got connected with React 19, and that was really, really helpful to find a community because you guys do provide a community.
So how long ago was it that you first connected with React 19?
I would say it was in April or May of 2022, like a year after he died.
Okay, so two. And you were heading up, I remember, I think I saw a video or something where you were heading up, bereavement, being a help to those who've been
Well,
bereaved.
yeah. When I went to Washington with Bree. It was, Ernesto, everybody knows Ernesto was there, but he was the only other bereaved person. Everybody else was vaccine injured, substantially vaccine injured. And we were trying, obviously, to get the vaccine on the VICP list, which, hasn't happened.
Right.
But one of the things I mentioned was, I said, this is all good. This is a good support for vaccine injured, but what is there for the people that actually lost people?
Exactly.
And so we started the bereaved site, Bree and I, and another woman in my community who lost her husband to HLH, which was a documented case also from the vaccine. And so we did that. And, people have written in their stories. Hopefully more will write in, and it's
I still
something.
think, like, as you said, many people just don't know, you
No,
know, I'm thinking of all these stories I hear that, they go to their doctor and they have all these issues. And, if their doctor is aware of what's going on, he connects the dots. But otherwise, I think of a family member that I have who took the vaccine, this extended family, and neuropathy. And to get in to see the neurologist was a 1,600 person waiting list. That should tell
that
us
tells
something.
me. Yeah.
That's like, okay, what's going on here? And so you think what more needs to happen to, get the public aware, or maybe the public is aware and just having the, politicians, the lawmakers, getting them willing to stand up. And have you done much in the way of advocacy with your local politicians? I mean, are they amenable to it? What has
I
been?
went with this wife that lost her husband that I spoke of, who's also part of React. We went to visit our local congressman. He was willing to listen, but he hasn't done anything. This is what I'm finding, that it's very much just lip service. Even in Washington, they'll listen to our stories, and I don't understand why, but generally it's one side of the aisle that will take these visits versus the other side, and it shouldn't be. This is something, whether you're a Republican or a Democrat, people are likewise being injured and dying.
Exactly.
So I think a lot of people that even know what's happening don't want to out their side too much,
Right.
because as long as it didn't hurt them, it's
Right.
easy to keep the blinders on. I call it willful blindness. Other people call it that too.
I have to say, like, I've been working with some people who've been running for office or have ran for office and have won and acknowledge, what's happened, and they're willing to fight for this. But I was really disappointed a couple of weeks ago. I went to our local public health department meeting. They have meetings every, 3 months or so. And all I did was read a statement. You have your 3 minutes to talk and you better, stay on task. And I basically shared what was going on and the moral and ethical responsibility that they had to make sure that if they were recommending, because these were doctors, somebody get a vaccine, that they had to know, they had to tell their patients that there will be no help for them. There has been no help, there is no help, and that they had a moral and ethical responsibility to let people know that. And I was told, well, you'd have to pass a law to do that, that they couldn't do that. It was so strange. And I had some conversations afterwards, and it hasn't been as fruitful that I'd like as I would have liked, not for my sake, but for the sake of the public so that they know
Right.
this. So I'm hoping to build a better bridge. At any rate, I know these doctors are good people. I mean, like, I know that I think most of them want to do the right thing, but I feel like they're captured. They're chained because, they're chained by the hospital, or they're chained by the CDC, and
But what's
and
the
then
problem? The problem is that most of these well, first of all, I wanted to say one thing.
yeah.
None of us were given informed
Oh,
consent.
absolutely. 100%. No one.
So when Victor went, if they had said to him, "Oh, by the way, you might get myocarditis, you might get pericarditis, there is a chance of, Bell's palsy, there's a chance of tinnitus, there's a chance of this or that, whatever," he wouldn't have taken it. None of us. We would have all been idiots
Yeah,
to
we
take
would
it.
all,
So there, and
that
also
mantra of safe and effective.
right. And I think another thing is, I know I did. I mean, I'm fairly intelligent. My husband's intelligent. My kids are intelligent. We all lost our critical thinking skills because of the fear that they put into us, that we couldn't see past the fear. And
Right.
that's something we can never give into again, because
Exactly.
they try again to put fear into us between monkeypox or this or that, whatever they come up with. We can't fall victims to it
You're
because
absolutely right.
we don't have informed consent. They know what's in the products. Oh, maybe some of them know, but maybe others don't. And as far as the doctors, I think the problem is that very few of them are independent doctors anymore.
Right. Joel talks about that, Joel Walskog.
Yeah. So the doctor that did the write-up for Victor, the case study, he's independent. And he said, the reason I can do this is because I am independent, but a lot of these doctors now work for big organizations, and they're,
Exactly.
15 minutes to see the patient. They have to have this. Don't say anything about that. That's not medicine anymore. And that's why
Right.
the public has lost trust in our medical system and will continue to lose trust unless the doctors start fighting back.
And I,
And
I think you're absolutely right. I saw, I just recently saw that Paul Offit had written, oh, the problem of misinformation and anti-vaxxers. And I'm like, no, the problem is not because of people who took the vaccine and got injured. The problem is because the government just hid it. I mean, think about this. Think about this, Hetty. Back in January of 2021, when the vaccine first started coming out, the NIH knew that there were thousands of injuries taking place. They fly out Bree and others saying, hey, we're going to help you. We're going to let the public know what's going on. And instead, nothing, silence. And they abandoned them. And
right.
and so the rest of us have seen this. We've seen this, what's happened. And we just, that is what is causing vaccine hesitancy, not
And those
because of some
and our
crazy
government is,
anti-vaxxers.
and if they had done the right thing, then Victor and all these other people would
Yes,
be alive. They wouldn't
absolutely.
be, to me, this is reckless endangerment with depraved indifference to human life. I just cannot understand how people have been allowed to continue in this vein. And I'm hoping that with things like coming out as they are, and like Victor's, because Victor's is one of the few documented cases. Also, another documented case, very well, Cody Hudson.
Oh, yes, Cody, just
That's
like,
another.
yeah, very much so. Heather, you and Heather are like just power horses, just getting this. You haven't given up.
No,
And I know that you won't. I know that you won't. And that I was listening to an interview that Bree did with Patrick Bet David. And at the end, he's like, well, what it's going to take is just a few core people who don't give up. And immediately I would put you in that category, Heather in that category, because I think the powers that be think that they're just going to get tired. This will
right.
just, hopefully these people all just die away and go away. And we cannot let that happen.
No,
We cannot
and
let that
I
happen.
will leave you with some. I will tell you something that I did an interview with a very Dr. Philip McMillan. I don't know if you know him.
Oh,
He's
yes, yes,
English.
yes, yes.
And he did it when the preprint came out. He was very interested in it because of the fact that we did the histology. He says, I've been saying this because you cannot say it saved lives when you have no idea if what people died from. There's no
Exactly.
risk to benefit ratio. I don't believe it saved anybody, but even if you want to make that argument, you don't have the data to prove it.
Exactly.
So he was very interested. You can go back. I can send it to you if you're ever interested.
Actually, I actually took that interview and condensed it and posted it
Okay.
on X. So I should have that. But send me the link anyway in case I have to.
But the one thing that really hit home at the end, he said, if there's any politician or any pharmaceutical people listening, just beware. The mothers and the wives are not going to forget or forgive. they will hound you or something along that line because I'm a mother. You're a mother. I mean, if you're a mother and they've taken your child's
Mm.
life away
Yeah,
when
yeah.
he was vibrant and had nothing wrong with him, and it wasn't, an accident that, you just couldn't. This was something that was preventable had he not taken it. So,
And think of the doctor's response is right out of the ER doctor. Oh, did he have the vaccine? So obviously that doctor had been seeing things, you know?
absolutely, that's what my husband said. For him to have come out, this was early on, because don't forget, this was in May.
Yep,
Early in May, Victor
2021.
died, 2021. It wasn't like a year later after there's
Right.
all the data. This was early on, so he had already been seeing things. There was no way that something he would come out and ask that question. And, and I would suspect that a lot of the population in Seattle was vaccinated. So, I don't know, but anyway, that was one of our clues. And a lot of the other things just started falling into place and listening to all the doctors and, and getting and doing what we had to do to, because I want to get justice for my son.
And that's
Eventually, I wanna get
understandable.
justice.
As
Yeah.
you've walked through these last several years, what are what is something that you learned that that you really learned that you just like never thought before, or just something about life that maybe you learned that that you didn't know 2 or 3 years ago?
Well, I don't trust at all our government at all anymore. Whatever they say to me, I don't trust them. I don't trust the medical establishment anymore. I don't trust them at all. I mean, I'm not saying there aren't good doctors. I'm not
Right, right.
there aren't good people within the government, but for the most part, I think these institutions have become, monoliths of like just greed and just promoting each other to with for power or whatever. They're not looking out for us. And the other thing is just hard to realize and understand that, family and friends that um, have had a hard time because of politics to acknowledge what has actually happened to millions of people, and that should not be. That should not be. And if you say certain things, oh, it's always, "But what about this? But what about" No, it is what it is. They could have stopped it. The administration that got the information in 2021 in February, those are the ones that had the information to
Yep.
stop it at that point, and there's nothing else to discuss. And unfortunately, these are some of the hard things. And of course, my life will never be the same, but that's to be expected for a grieving parent. So, yeah.
Yes, especially with a son that was such a light. Is there any final words that you would just like to leave the viewers or listeners? Just
Well, I don't know if I'm speaking to the choir, but if there is anybody that is still thinking that there's no reason not to take the vaccine, I would tell them to look into everything, to be cautious. You could be playing Russian roulette. You may be lucky, but why would you take that chance? I mean, so many of us took the vaccine. We're lucky, but so many of us weren't lucky, like my son. And I would just caution them to really look into things. I can't tell people what to do, but I would caution them to really investigate and not just to listen to the mainstream media.
absolutely,
Yeah.
absolutely. Well, I thank you so much. I'm just glad we got this time just to talk about Victor, that people, might just have met him for the first time through this interview, and just to know the life and light that he was. And I'll put, all the information we've talked about in the show notes. And can people contact you then through React 19?
Well, I'm on the bereaved site, but I don't think there's an actual mechanism, but I mean,
Okay.
they could probably contact, someone who could contact me.
Okay. So if anybody would out there would like to connect with
I'm on
Victory.
Twitter. I'm on Twitter.
Okay. Yeah. Victor's voice.
Victor's Voice too.
Okay, and I'll put that in there too.
Emmy
So,
or something like that. Yeah.
all
Um,
right. Well, let us keep shining the light of Victor, of light, of having truth. He would want that truth to go forward. And oh, I'll put the information about the scholarship too. I think that's just Just to think at his young age as a college student, who
His first
who
year.
does that? Who
I
does?
know, and I even used to say to him years later, I said, "You're still doing that?" You know?
Oh my gosh.
You
Well,
know?
thank you so much. And yes, let's just all remember the light and life of Victor.
All right. Thank you so much, Anne. I
You
appreciate
bet.
it.